Dean of the College of Arts and Sciences, and I'm pleased to introduce our speaker tonight. But first I want to thank the person who's mostly responsible for bringing Brendan Kelly here, who is Shar Walther. Well, a little secret, which is that tomorrow night, Shar Walther will be awarded the Quinnipiac Teacher of the Year Award. She's hanging her head and saying, no, it wasn't me. I owe it all to the team. I'm happy to introduce Brendan Kelly. Brendan is a senior lecturer in psychiatry and a consultant psychiatrist for the Department of Adult Psychiatry, University College Dublin. In this position, Dr. Kelly plays many roles, including the following: leading a clinical team, teaching medical students, chairing committees that shape mental health delivery in North Central Dublin. He's also editor-in-chief of the Irish Journal of Psychological Medicine, and recently served as president of the Psychiatry section of the Royal Academy of Medicine in Ireland. He holds many degrees. Listen to this now. An MD with a specialization in psychiatry, a doctorate in history, and another in law, and master's degrees in Buddhist studies, healthcare management, and epidemiology. He's also a fellow of the Royal College of Physicians of Ireland and a member of the Royal College of Psychiatrists. In other words, he has done clinical research. He's done research in, he works in mental health law and human rights. He has an abiding interest in Buddhism, and he's doing ongoing research on the history of psychiatry. In other words, this is, he is the nth degree of what we say in College of Arts and Sciences, which is a creative mind in action. In other words, he is a scholar and a person who applies that in daily psychiatry in North Central London. North Central Dublin. Okay, and sort of a classic mistake. And tonight it looks like he's going to talk about literature as well with Bram Stoker. I'm happy to present Dr. Brendan.
Thank you very much. Super, thank you very much. How am I doing here with the microphone? Everybody happy? You people at the back, can you hear me? Put up your hand if you can hear me. A little louder. I speak a little louder, okay? Do we have a volume control? I don't know. Can you hear me now? You okay now? Okay, good. Well, Brendan Kelly is my name, and I'm going to talk a little bit about vampires. I take it you're all here because you're interested in vampires to a greater or lesser extent. Good. I have spoken about this in a number of places, and I'm looking for an audience member who self-identifies as a vampire, because some people self-identify as vampires. And so far, I have not met such a person. Maybe tonight is my night, okay? So as I go along, if you want to come out, as it were, pop up your hand, point at your head, and I will go up to you and embarrass you tremendously. And I'm really looking forward to that. I hope tonight is my night. What I'm going to do is I'm going to introduce you to vampires, talk a little bit about what they are, talk about Dracula, a particular novel and its connections with Irish medicine. I'm going to go through a clinical case, talk a little bit about the medical literature about vampires, and come to some conclusions. All right? So let's start with vampires themselves. I'm going to introduce you to some of the cast of characters in the history of vampires. Has anybody heard of this man, Vlad the Impaler? Yeah, hands are all up there. Or hang on, are all you people self-identifying as vampires? There's going to be a lot of confusion about this. So, okay, you've heard of Vlad the Impaler. Vlad was a particularly bloodthirsty warrior, and he was a prince in Eastern Europe. And he was famed for impaling his victims, hundreds of them at times. and it was said that he also engaged in vampiric activities. Now, vampiric activities involve acting like a vampire, and a vampire is a reanimated corpse that needs to feed on the life essence of living creatures in order to continue its existence. And the life essence upon which it usually feeds is what? Blood, most commonly, but it could be something else. And that's what a vampire is. Now, a lot of the mythology and stories about vampires come originally from Eastern Europe, but they can be found in most traditions in some fashion or other. Here's an image of a vampire, and vampires refuse to die. It's incredibly difficult to kill a vampire. And clearly the person in this coffin was considered to be a vampire, wasn't staying in the coffin, so they've opened it up and they're driving a stake through the skeleton in order to kill it. Most of our contemporary images come from movies, though. Has anyone seen this movie, the 1922 Nosferatu? Yeah, a lot of people have. It's a really good movie, and it's one of the archetypal images of the vampire. You can see this image here, a tall person, kind of gangly, very pale. And that's interesting because in Eastern Europe, the vampires tended to be red-faced or ruddy, but now they've kind of become pale. And another addition to the myth is that they dislike the sunlight. And these features of vampirism came over time. It's very much a multi-layered phenomenon, and it changes so greatly, as we'll see as we go on. Coming here to Quinnipiac, and I am delighted to be here, so thanks to Quinnipiac and to Shar for setting all this up. I was intrigued to find out that in your Great Hunger Museum, you've got two images really relevant to the emergence of the vampire myth, certainly in the Irish context. This is a picture of an Irish farmer and his wife, and they're reading the newspaper. And what's happened is their son has been arrested for a bombing campaign in London. And if you look behind the mother, if you zoom in, you see this lithograph here. Now this here is a portrayal of Ireland. Ireland is commonly portrayed as a young maiden. And this bird of prey is feasting on her. And the bird of prey represents England, basically, with whom I was confused earlier on. And so England, controlled Ireland for many, many years. Ireland was part of the United Kingdom of Great Britain. And this image shows England feasting upon Ireland. But what's fun is a kind of a reciprocal image also in your museum, which is a cartoon from Punch. And this shows the Irish vampire. And this again shows Ireland as a young maiden, but this time it's a vampire bat feasting upon her. And it is one of the Irish Home Rule movements. And this is a British cartoon suggesting that parts of the Irish nationalist movement was just really feasting on Ireland. And it's a very potent image, and it's a really nice image for me to have found here because it locates the vampire myth very firmly in Ireland, and it does so in 1885, which is prior to the publication of Dracula, which is tremendously interesting. So I'm very interested in this. Of course, there are links, in any case, between Ireland and the vampire myth. Does anybody know what this is? What are we looking at there? It's blood sausage. Do you have that around here? Do you eat that much in Quinnipiac? Is this a Connecticut thing? Anyone have no idea what I'm talking about? No idea at all. Hands up. There's a lot of people, I'd say. This is a kind of a sausage that's made primarily of the congealed blood of cattle or pigs. It's eaten in a lot of countries around the world. Other stuff is added into. It's eaten in Ireland somewhat, Scotland, it's eaten in Portugal and various other countries. Parts of China eat it quite a lot too, and it's blood pudding. And this could be arguably a rather vampiric way to start your day. It's a breakfast food primarily, and it's quite common in Ireland as well. Anyway, to get back to the movies. As the years go on, the vampire myth changed, especially in the movies. Has anyone seen this one? This is a good movie, Herzog's Nosferatu. It adds a distinctly erotic element to the vampire myth, and that's something we're going to keep coming back to. Or this one, Shadow of the Vampire. Now this is a really fun movie, because this movie is about the making of Nosferatu back in 1922. And the hypothesis in this movie is that the actor who played Nosferatu in the 1922 movie was in fact a vampire. And there are various scenes in which he feasts upon various kinds of creatures, living creatures. And this is a picture of the John Malkovich playing the vampire in the movie. Okay, so now another competition. Can anyone name this actor? Bela Lugosi. Okay, so Bela Lugosi is the classic actor in vampire movies, a Hungarian actor who played in a lot of these movies, and when he died, he was buried in a vampire cloak because he struggled in his career to ever break free of this being cast as a vampire. And it was a cause of great difficulty to him and great unhappiness, apparently, that he couldn't move substantively into other roles. Now, he also married 5 times, which seems like another cause for unhappiness. But when he died, he was buried in his cloak precisely as he wished. Anyone know this vampire? This is my final one. So this is maybe not so scary. And I've put this up here. This can't possibly be scary because he's being pictured with Kermit the Frog. And wherever Kermit is, everything is going to be okay. So this is the Count from Sesame Street. Does Sesame Street still run on here? Is that big for kids here? Okay. What does the Count do? What does he like to do? He likes to count. Okay. So the myth, the vampire thing goes everywhere, and it gets everywhere, and it changes. And this is what I want to talk about, is why it gets everywhere, why we still like it centuries after it became sort of a feature of so many mythologies. Part of this is due to this novel, Dracula. So who's read this? I know someone told me earlier they read it recently. Dracula is a fantastic novel. If you put aside all the academic requirements to read it, the footnotes, the history, it's just a really fun book, and it's really well written by Bram Stoker. So Stoker was born in Dublin, in Clontarf, attended Trinity College in Dublin, and worked for most of his life as a theatre assistant at the Lyceum Theatre in London. And he was an assistant to the actor Henry Irving. And, when Stoker died, it was pretty clear he would be remembered mainly for his writings about the theatre. But as the years went on, it became apparent that Dracula was a Gothic masterpiece, and several other novels that were not quite as good as Dracula, but very solid and very Gothic. And Dracula is really good fun. Stoker had 3 brothers who all qualified as surgeons. This is the most famous of them, William Thornley Stoker. This is his obituary from the British Medical Journal. And Stoker lived with these brothers at various points. And we know that in Dublin at that time, this man, a Dr. Robert MacDonnell, performed the first blood transfusion ever performed in Ireland. And this was reported 5 years later in the Dublin Journal of Medical Science. And we know that the Stokers received this journal. Now, those of you very familiar with Dracula will be familiar with a transfusion scene in which Van Helsing performs a blood transfusion on Lucy. And the description of that in Dracula is exceedingly similar to the Dublin Journal of Medical Science description, which Stoker most likely read. So Stoker looked to a lot of sources because Stoker never went to Transylvania prior to the writing of the novel. He was not a well-traveled person, especially. The other important medical connection, of course, with Dracula is the character Dr. John Seward. In the novel, Seward, one of the main male protagonists, is an asylum doctor, and he's in charge of this huge asylum at a relatively young age. And he has a patient called Renfield who has zoophagia. Has anyone ever had zoophagia? Even a touch of it? Anyone? No. It's funny, isn't it? Zoophagia is what is it? Does anyone know what it is? Zoophagia, phagia being a hunger or an appetite for something, and zoo meaning animals. It's an appetite for eating or consuming live animals. And no one has done that here, no? And it's funny how we think it's weird to eat live animals, but a lot of us are pretty chilled out about eating dead ones. If anything, you would think eating ones that have been dead for a little while would be a little bit stranger. But anyway, Renfield eats live creatures, and in the movie portrayals, Renfield is always shown as a very sort of disturbed-looking fellow. And Renfield is one of the most interesting characters because they think he is Dracula at various times. He seems to be a vampire, and then he isn't. And odd actors get to play him. Anyone recognize who's playing Renfield here? The singer, Tom Waits. How about that? So anyway, the point is that when Dracula came out, it wasn't very well celebrated, but over the following years, it really came to epitomize the image of the vampire. Although it didn't invent it, it came to epitomize it, and it dominates the vampire imagery today, even to this very day. So why am I interested in this? I think from the introduction you'll see that my career has suffered from a sort of a wide variety of interests, shall we say. I want to tell you what brought me here, though. In 1999, I was 3 years qualified as a doctor, and I became like a junior resident in psychiatry. It's the first part of my clinical psychiatry training, and one of my first nights on call in the emergency room in a Dublin hospital. One of my first nights on call, I was called to the emergency room to do a psychiatric assessment on a 23-year-old single male who came to the hospital saying he had given up on love. He said, "We are going back to the animals. New illnesses," he said, "were appearing on the planet, and one of them is vampirism." And he said he was turning into a vampire. All right? Has anyone ever had that feeling that you're turning into a vampire? Yeah, some of you are nodding bizarrely. So if you have, you know how disturbing it would be. And you need to go to a hospital to see a doctor, apparently. He said he had to drink blood or else he would die. He said, not unreasonably, that prior to birth, the fetus drinks amniotic fluid and blood, and that he needed to do the same thing. But he was a nice guy. He didn't want to kill anyone. He didn't want to bite anybody. He was a nice guy. So he came looking for the supply of stored blood in the hospital that would be used for transfusions. And he said to me, "Give me a few pints of your blood from the hospital and I'll go away again. I'll be fine. Don't worry about me." So what do you do? I was brand new to psychiatry, and I thought, wow, this is an amazing field I've entered. It's so interesting. These complicated, fascinating presentations. So in any case, we decided that he was mentally ill, that he had a delusion. And you can see here, I'm using the DSM system here. Do you know the Diagnostic and Statistical Manual, the DSM? Anyone know what that is? It's basically a method for diagnosing things. Psychiatry, we diagnose based on symptoms, lists of symptoms. There are no biological tests for anything very much. So in order to put some kind of shape on the field, there are lists of symptoms we're supposed to use when making diagnoses. It is a very imperfect system, and it's only a guide. But it puts some structure on the field. So in the DSM system, he gets a diagnosis of schizophrenia with fantastic delusions. We admitted him to hospital voluntarily after quite the bizarre discussion. He was absolutely convinced of his beliefs. And we treated him with an antipsychotic medication called risperidone and with some lorazepam as well. And over the following 2 weeks, he chilled out a lot. When he came in, he said that he could only eat meat. He could not eat vegetables at all, but he began eating vegetables. We saw him. He said that he could not walk in front of a mirror because vampires don't cast reflections, but I saw him and he did cast a reflection in a mirror. So I'm not claiming this person was a real vampire. And in time he came to agree with me, and he said he no longer believed he was a vampire, but he would always like black pudding. And with that, he disappeared into the night, and I never saw him again. So I thought this was a fascinating story, and I wrote it up as a case. I went to the literature, I looked at the scientific literature and the psychological literature and the meanings attached to vampirism. And I wrote up a short case report in 1999, but it was apparent to me that there was a lot more to this field. Now, it took me 11 years to get back to it, but I got there, 12 years, I got there in the end, and decided to look more closely at the medical history of vampirism. And I wrote a couple of papers, and that's why I'm talking to you today. So that's the case. That's what got me into this. Now, when I went back to the medical literature, I came across about 4 key papers. All right, and this is really the heart of what I want to share with you this evening. You can still hear me okay? No. You can't hear me? Okay, I'm kind of as loud as I can get. Is this microphone on as well, maybe? Okay, I'll just try and shout a little bit louder, okay? Okay, so The next section here is about the medical literature. One of the most interesting papers comes from 1964, a journal called Archives of General Psychiatry, which was the world's leading psychiatric journal at the time. And this is a really interesting paper because it demonstrates a lot of the problems with the literature on vampires. These authors looked at a few cases. The first one was a case of auto-vampirism. And this was a gentleman in prison who could manipulate a jet of blood from his own artery straight into his mouth by making a little cut here and flexing his wrist, all right? And then he'd get jets of blood going into his mouth. This is pretty gruesome. Another man, also in prison interestingly, was trading sexual favors with other prisoners who in return let him suck their blood, all right? So this is pretty grim stuff. But what these authors do, and this is the value of their paper, is they draw attention to the definition of vampirism, and they call it the act of drawing blood from an object and receiving excitement and pleasure. So they're introducing the idea of enjoyment and pleasure into vampiric activities. The original myths from Eastern Europe did not focus on pleasure very much. They were darker vampires. Often bestiality was involved. It was a dark myth. What's happened is it's become prettier. A lot of the vampires you see on TV today, a lot of the vampire series and the novels and the movies, these are very pretty looking vampires. Pretty boys, pretty girls, playing at being vampires. The original myth was a lot darker. But these authors are bringing in the idea of pleasure and excitement into the vampire story. And this, in a sense, it was always there. When you look at the older images of vampires, there's a certain relishing of blood, as well as a necessity. There's a certain sense in which it is being relished. And of course, then you had a whole series of movies which were frankly, erotic. And there's a whole field of vampire pornography as well. But a lot of the movies had a strong sexual element. And you can see here, this actress, Ingrid Pitt, features in quite a lot of them. And you had these female vampires bursting forth, as it were, from coffins, like leaving little to the imagination, and really emphasizing, if you like, the sexual element of the myth. There were also fairly daft movies, The House That Dripped Blood. I don't expect anyone to admit having seen that. I saw it, and you don't need to bother. I've watched that for you. And here was Ingrid Pitt, the queen of the vampire movies in her day. It has changed now. Does anyone recognize this person? Who is this? Buffy the Vampire Slayer. And is Buffy a vampire? No, she's a slayer. There are times, though, when she seems to be a little vampiric, where you worry she's become a vampire, but they tend to keep that tension going. Who's she with? Angel. Absolutely, yeah. No, for me, this is the prototypic vampire TV series. Anyone know this one? You all know this one. Has any adult actually read these novels from a literary point of view? Oh my God, these novels. But why I want to talk about it is this. When you can live forever, what do you live for? Now, look what has happened. The vampire myth, when it started, people were frightened of vampires, okay? We didn't like them. The literature has shifted. Our sympathies have moved. Now we feel sympathetic. It's tough being a vampire, apparently. You live forever and other people don't. You got to find blood. It's just dreadful. And now the literature has swung completely toward us being sympathetic toward the vampires and the day-to-day difficulties they face in a cold and rejecting society. And that's Twilight. Multi-million selling novels and movies and all kinds of things, and very interesting, very potent tapping into the myth. But I want to go back to my paper, the paper I'm talking about in 1964, because this was, there was a lot of psychoanalysis going on. Today, the psychological dimension of mental health care is largely focused on cognitive therapy, behavior therapies, but there was a lot of psychoanalysis going on. And they analyzed one of these two cases I mentioned, and they say that in the first case, this is back in 1964 now in the Archives of General Psychiatry. In the first case, the early stages of psychotherapy revealed that blood symbolized an unobtainable object or forbidden fruit which, as his therapy progressed, proved to be unobtainable or forbidden wishes towards his, anyone guess? Mother. Yes, psychoanalysis tends to lead back to mother a great deal, and maybe everything does kind of lead back to mother in life as well. But these people believed that the expression of the vampiric desire was an expression of the need to be nourished by the mother, but it was combined very clearly with a sort of an act of quite significant violence toward the mother, as it were. So it's an interesting combination of conflicting impulses toward the mother. And they concluded, the paper is very long, but they concluded that the symbolic representation of blood should always be investigated as an important clue to better understanding pathology. And blood could symbolize pretty much anything, they felt: Oedipal wishes, fear of castration, aggressive, hostile wishes. So their paper was really interesting. And it said, if people come to you complaining of vampiric problems, you got to look at what blood means to them, and searching for blood means. Quite a subtle paper, you know. It was reported on in this, a few months later, Popular Science Monthly. Does that still exist? Anyone still have a subscription? No, I don't think so. I like it. I like this thing. Tiny TV sets are in. And I wonder what would they make of us, you know, watching YouTube on our iPhones and so on. Well, they reported on the Vanderberg and Kelly paper, and, vampires are sick, psychiatrists assert. Now, that is not what they said in the paper. The paper was really very subtle and said, for each individual who talks about these things, you look at the meaning for them. Human vampires do exist, according to Denver psychiatrists. I mean, that's not what they said, even vaguely. Rather than being undead, they are mentally ill. That's not what they said either. In the archives, 2 psychiatrists reported rare cases in which vampirism or sucking blood was part of a pattern of homosexual behavior. I don't know how many prejudices they've managed to wrap into that little soundbite there, but you got a lot of them, you know. It was a dreadfully misunderstood paper. I want to move on to another paper too. I want to talk about this one. This was not as good. I don't like this paper the way I liked the last one. This is a paper by Lawrence Caton, and it's about schizophrenia. And Caton talks about the symbolism of vampirism. And he says the attack of the vampire is a condensation of 3 acts consistent with unconscious fantasies: partaking of life by the oral route, the object is held and controlled, and after feeding, the victim becomes a vampire, indicating a merger. Fear of attack and destruction by ill-defined part humans can be seen in persecutory delusions. Now, I struggle to see this. I don't agree with this. This does not seem right to me. He makes some other good points, though. Sometimes people with certain mental disorders, especially schizophrenia, complain of feeling less visible. They feel they're less part of a group. It's something about self-image and theory of self, maybe. And maybe there is a parallel there with the vampire not casting a reflection. That's what Caton says. I'm not so convinced. Sometimes people with certain mental disorders get a reversal of their day-night cycle, up at night, asleep during the day. That's something vampires do too. But I still think it's really stretching it to say the vampire theme presents psychiatry with a unique phenomenological view. But Caton redeems himself at the last minute with this little gem. Do vampire movies give us vicarious fulfillment of our oral sadistic needs? Now, what this means is that maybe we all need to bite stuff. Maybe even people. And rather than doing that, isn't the world a much better place that we fulfill that need by watching it in the movies? All right? So vicarious fulfillment of our oral sadistic needs. And this sounds like a good thing to me. Look at this. I mean, you can feel the tension in scenes like this in vampire movies, surely, as he's about to bite her. She is lying perfectly placed for this. Do not sleep like this with your neck exposed, because she's asking for it as far as I'm concerned. And look at this, again, there she is about to be bitten by Dracula in a nightmare of horror. And I really like this one. If you dare, taste the deadly passion of the blood nymphs in the vampire lovers. But what I like about all these women rushing out to bite these men is this little bit here. Not for the mentally immature. Not for the mentally immature. This is exclusively for the mentally immature. Only the mentally immature could possibly enjoy this. Okay, the third psychoanalytic paper I want to mention is this, a very interesting one by Robert McCulley that appeared in '64, looking at auto-vampirism again. And he used this. Anyone know what this is? Yeah, it's an ink blot. Does anyone, who doesn't know what this is? I need a subject to tell me what that is. What does that represent? Because this is a projective test. This is a test where the person is basically asked, what do you see, or what do you think, or say something in response to this, okay? The image is designed to be meaningless. One of these guys who did auto-vampirism, they analyzed him, and here's what he said. He said, it is the lower part of anatomy of a large animal. The overall shape is part of a living thing, or once part of a living thing. The red could be blood that came from it, ripped out, dissected. This is not new. A second look, it's oozing out, and it looks like it drains symmetrically. Do you all see that? Do you all see it that way? Now that I say it, yeah, it's pretty obvious. Okay, next the person said, I'd like to turn it. Alrighty, we turn the image upside down, and now it's like a skull with the top part removed. So this is very, very violent, very sort of visceral imagery this person's coming up with. What do we conclude? The authors conclude there was a riveting of attention upon an unconscious content, the archetype of vampirism. So in other words, the idea of the vampire is something very profound, and that all of this person's attention, or what they call libidinal energy, their life force, if you will, was all concentrated on the idea of the vampire. And the idea of the vampire dominated. That is to say, there was no conscious participation. It just ruled, the idea of the vampire came to rule all aspects of this person's mental life. The subject became a passive carrier of the projection and a prisoner of it. He was a prisoner of the idea of the vampire. The archetype which, like all archetypes, is meant to resonate with something in each of us. In him, it became so strong, he became a prisoner of it. And that's a very analytic interpretation. So they were the analysts. There was another fun paper in 1985, and what I like about this is it moves from the analysis. It doesn't look for meaning. This person wrote to 50 psychiatrists and said, have you seen people who do vampiric things? And if you have, what did you diagnose them with, if anything? Okay? And what you find is when people come to a psychiatrist, they get a diagnosis, you know? And these people had, what I really like about this paper is the page number it starts on, 666. I think some editor somewhere had a lot of fun when he was putting together this issue of the British Journal. He wrote to 50 psychiatrists, and the most common diagnosis given to people with vampiric behaviors were schizophreniform disorders, hysteria, psychopathic disorder, and learning disability. So these psychiatrists diagnosed these behaviors as part of other disorders. But they finished the paper with a really nice analytic flourish. They say further work could be directed at making clearer links between legendary and clinical phenomena. A Jungian framework. I mean, this is made for Jungian interpretation. We got blood, we got biting, we got mothers, you know. What more could you want for a Jungian party? And they quote Macaulay, who said, what lives in the forest beyond is shrouded in mist, and as yet we have but clumsy means to explore it. So even this paper ended up with this appeal to the mysterious that the vampire appears to bring out. What we do know, though, is the myth is a violent one. At its heart, it involves the vampire biting other people and transforming them. A very potent communication. And on the other side, we have violence in return, because a vampire can be killed by driving a stake through its heart. A very, very violent act. Now, it may be a symbolic act. I mean, You don't need to be Sigmund Freud to figure out just what it is Peter Cushing is thinking about in relation to Ingrid Pitt here, as he hammers this huge stake through her heart. But it is violent. And what we know about people who self-identify as vampires is they do appear to have a certain risk associated with it. Here's a case where an individual with schizophrenia engaged in vampiric behavior and cannibalism, okay, which is obviously very disturbing. Here's a report from the Irish Times 2 years ago. Listen to this. A man entered a hospital with a knife, said he would torture, kill, and have sex with a doctor, giving him psychiatric assessment. He pleaded with the doctor to give him a drop of her blood to drink before he lunged at her and tried to strangle her. So this is a violent myth, and these can be violent thoughts. Now, that is not to say that every individual who self-identifies as a vampire is violent, far from it, but it can happen, and care needs to be taken in relation to this. But this is a problem now because we have this vampire chic emerging. Anyone know who said this? When other little girls wanted to be ballet dancers, I wanted to be a vampire. You may have said it yourself at some point. I don't want to know that. I want to know what country do you think she came from? The United States of America, guys. I'm sorry. Anyone know who she is? Okay, that's interesting, because when I do this, everyone else knows. Anyone know who she is? Yeah, you know this person? Maybe this image will help. Okay, maybe this one? Okay, so it's written here. All right. This is one of a quote attributed to her, but I don't know is it true or not. What I do know is the Boston Globe in 2001 reported the following. They quoted Ms. Jolie, "My husband's blood is the most beautiful thing in the world to me." Signed their wills in blood, and Jolie and Billy Bob Thornton had his and hers cemetery plots in Louisiana. And there we have a happy couple wearing each other's blood. All right? Now, it is with great sadness, I tell you, the relationship did not last. And it's always sad when a relationship ends, right? Happily for Ms. Jolie, I don't know what became of Mr. Thornton, but Ms. Jolie found someone else. Of all the people. This image is from what movie? Interview with the Vampire. Yeah, okay, and here's Brad Pitt. And there they go, Mr. Cruise and Mr. Pitt. Okay, it's interesting how this is what happened, and her quote has become quite celebrated on T-shirts and contributed to this thing about vampirism being an acceptable lifestyle choice. Sorry, I only date vampires. That's my favorite T-shirt of all the ones I came upon. This came to its inevitable conclusion in, of all places, Utah, where an inmate in prison claimed he had rights, vampire rights. Robert Rice was sentenced in Utah for felony weapons possession. On his inmate classification sheet, he claimed he was a druid. The order of druids I follow is the order of a vampire. As a vampire, he said he had to partake in the vampiric sacrament involving drinking blood. And as a vampire, he must be allowed a conjugal visit with a vampress to drink the blood as per his religion. He sued the prison for violating his right to practice his religion and failing to provide him with a vampire diet. How about that? Now, I think there are some states in your great country where this might have succeeded. But I'm not going to name names. But the Utah Court of Appeals, I'm pleased to say, had no sympathy for his position, and they dismissed his complaints just days before Halloween. Okay, so we know what vampires are. They're the reanimated corpses that have come back, all right? They need to drink blood, get the life essence from living creatures in order to exist. A lot of our current images come from Dracula, a scene-changing novel in the vampire world. I've told you about a case in the medical literature, starting with strong analytic interpretations in the 1960s and 70s, moving through toward a more classification-based approach in the DSM. Now, this interests me hugely, and this is the most recent paper we've done. We used vampirism and changing attitudes toward it as a way to look at how psychiatry has changed over the years. And this came out just last year. We write, DSM, that's the classification system, it asks if a delusion, like believing you're a vampire, is it mood congruent? In other words, if you're depressed, you should have sad delusions, and if you're elated, happier ones? Or is it bizarre? And these are yes or no questions. And that's as far as the DSM goes in looking at the content of a delusion. So you come with any kind of a fixed false belief, believing you're a vampire, believing that you've been sent from an alien planet. DSM just wants to know, is it congruent with your mood, or is it bizarre? Not really interested in the actual content. And this is important in one sense. We need the DSM because it allows us to do clinical trials and formulate our treatment, and it's important in lots of ways. But when you look at the vampire myth, when I diagnosed that patient, I diagnosed him as having 295.30. I mean, can diagnosis become any more depersonalized and dehumanizing than that? One of these authors I've quoted to you would have looked at the symbolic representation. They would have searched for Oedipal wishes, fear of castration, hostile impulses. We don't really do that so much now. We just diagnose. And the point of our paper was that in this process, which is important, we do need DSM. We need to be able to do trials and so on. But our richness has been lost here. A way of thinking that put the meaning of the experience at the center of our efforts to understand what is going on. And this helps when people are recovering. Why did this happen to me? Why did I believe I was a vampire? Why didn't I believe something else? Why this odd belief? And people don't abandon a delusion like flicking a switch. As they recover, it kind of fades away. And it's important to have an interaction or an explanation as the belief subsides. Anyway, that's what we think, and that's what we wrote in our paper. And our paper was a bit like the first one I mentioned. We talked about speaking with people about what their vampiric activity means to them, what need they're trying to fulfill, how it matters, because not everyone who thinks this way or acts this way is mentally ill. They're not. And that's what our paper wanted to do, to bring out a more nuanced approach. So we're near the end now, you'll be pleased to hear. Our paper came out, and a few days later, the Sunday Times, a British newspaper, carried an article about it on the front page. Our paper was long, it was subtle, it was really well informed, it referred to literature and psychoanalysis and psychology, and I was pretty proud of the thing. Anyway, it got reduced to this: doctor treats vampires. How about that? Here we go. A psychiatrist, that's me, has done a study of vampirism as a mental illness. And this was on the cover, on the front page of the Sunday Times, after a man visited a Dublin hospital. Brendan Kelly said his interest in the vampires started in the 1990s when a man came asking for blood from a hospital. He did not want to hurt anyone. Psychiatrists attribute such beliefs to a mental illness such as schizophrenia. If my paper did anything or tried to do anything, it clearly failed completely. It was to move away from that and look at the meaning of the symptom for the individual. But hey, this is the front page of the newspaper. And I said, apparently, it is important contemporary psychiatrists seek to diagnose the type of mental illness. Helping them may find a clue as to why they were drawn to a particular belief and aid with recovery. And the rest of the article was not too bad. But it really reduced what we were saying to a kind of a bumper sticker, whereas our paper was pretty long for a reason. And by the way, I'm going to put up my email address at the end if anyone wants to email me for papers or anything. So this appeared, and this kind of echoed, because the Sunday Times is online, and it started this whole thing, right? Another newspaper the following day really boiled it down. A Dublin doctor studying vampires, as if I do nothing else, has said it's important to diagnose the type of mental illness. That's not what I said. After being approached by a man seeking blood stocks because he did not want to hurt anyone. It got discussed on the radio the following day, but the real action started on the internet, which has been a blessing for the vampire community, and it allows them to connect in new and exciting ways. The real vampire news for the real vampire community. Now, I don't need to tell you they took grave exception to my paper. Not so much my paper. I see no evidence any of them read my paper, but they took grave exception to the version of the paper presented on the front of the Sunday Times. Irish shrinks say vampires are schizophrenic. This is so frustrating for me, because the point of our paper was not that this is not the way to go. It's important contemporary psychiatrists diagnose the type of mental illness that causes vampiric beliefs and offer treatment. That's it, folks. The experts have spoken. If you believe you're a vampire, then according to these doctors at the Mater Hospital in Dublin, you're a fruit bat. How about that? Dr. Kelly at the Mater Hospital studied the mental illness. A study carried out by him found psychiatrists should engage more with their patients to be... This is a quote from the Sunday Times, okay? They did not read the paper. We should engage with our patients, but this is the vampire writing. I don't like this last bit. They don't mention the degree of engagement necessary. See, I don't like annoying these people because they self-identify as vampires. Commenting on this article, Octarine Valur, who heads a real vampire coven in South Africa, said by the logic in this premise, if a person's beliefs make them schizophrenic, then everyone is mentally ill, simply because of what they believe. Adherents of some belief systems are mentally ill, and others are normal or healthy, despite the obvious fact that most self-identified vampires lead lives that could be described as normal and healthy, regardless of what they believe. All right? There we have it. Next time you feel the thirst with a capital T, call your shrink. So it's all in my head. Okay, doc, tell that to vampires who suffer serious illness when they stop feeding. So this is, to me, a misinterpretation of my paper. But it goes on. This is being discussed constantly. Earlier this year, this other vampire website said, okay, vampires sometimes show symptoms, but this may be due to the distress caused by inability to feed often enough, or the stress from social prejudice at the hands of co-workers and family, and wild claims, such as made in this article. Now, this is extremely frustrating for me. No doubt, adding the stigma of mental illness adds weight to bullies. That would be me. Vampirophobes, again me, who view us with skepticism and disdain, although I doubt these two, that's me and my co-author, would worry about reinforcing bigotry. After all, it might boost their income. I can tell you, writing about vampires has not boosted my income at all. If writing about vampires and talking about vampires boosted my income, I would not be here today. I would be on a yacht somewhere enjoying myself. There's no money in this, if you're getting interested. I suppose the vampire community should not expect impartial or insightful reports from them. After all, they are not actual doctors. Well, let me tell you, I am. Every which way you want to look at me, upside down, inside out, I am a doctor from all angles. There I am. A web-based discussion ensued. Somebody wrote in, "Hi, my friend was one of the doctors quoted in this article. Neither he nor I have vampiric tendencies. The journalist deciding presenting the research in a one-sided way would make more newspapers get sold. This does not represent my friend's attitude. He is intelligent, accepting, and broad-minded, whose interest is to do his job well and help people when they need it. Thank you, S." Well, I got to say, thank you, Mom, because that's the only person who could possibly have written such a thing. But it's worrying for me, because if my mom spends time on vampire websites, I have really misunderstood her all these years. She is a more profound and nuanced woman than I ever knew. So I'm going to actually finish now. The vampires we've spoken about, it's a myth. They don't exist, all right? But it's a potent myth. Dracula is a really good exploration of the myth, a nice subtle book. It does crop up clinically, and the medical literature did what it does with this myth. It changed over time. Psychiatry, psychology changed their views so much, and it says more about our discipline than it does about the vampire story itself. And to conclude, I do not believe all people who self-identify as vampires are mentally ill. Some probably are, some probably aren't. It's a complex phenomenon. There are degrees of engagement. People enjoy vampire movies. That doesn't mean they're ill. People have vampire groups or covens, apparently. That doesn't mean they're ill. But there may come a point when, like with any behavior, it can constitute part of a disorder, but not always. If you want any papers of that, you can send me an email. This is probably the last one we're going to write about vampires, but it's not going to go away, because I agree with the archetypal theories that it appeals to something in all of us to differing extents, and we like different kinds of vampire phenomena. A lot of people really like Twilight, or is it True Blood? Is that one? Yeah? Some people prefer the novels. But for me, the vampire fantasy will always be Buffy, and maybe someday, maybe. Thank you very much. Okay, what do we do now? Do we have questions and things? Yeah, if anyone wants to ask questions, I'll happily answer questions all evening. Yes, sir?
A lot of your references to early 20th century pop culture.
Yeah.
What is your earliest reference to vampirism? Was it Middle Ages, or
Yeah.
you never mentioned it?
Sure. So the question is that many of my references were to quite recent pop culture. And when you go back, how far back can you go with the vampire myth? And you can go way, way back. Freud didn't talk about vampires, which is really interesting. Jung spoke about vampires greatly. And you can go right back as far as you can. You can go right back to very early Hebrew literature and find stories about vampires. And you can find them in pretty much all traditions. You can find vampires way back in all of these early religious texts. And you could argue a lot of religious rituals involve blood to a certain extent, or at least the symbolism of blood. So way, way back is my best answer, I'm afraid.
They call it vampirism.
No, they don't call it vampirism. Some of the early Hebrew texts do. They approach the word, but the word probably didn't emerge until maybe the 1400s or the 1500s, when it emerged probably with a W rather than a V. Okay, any other thoughts or questions? Any other ideas? If you want any papers or any leads to these websites, feel free to drop me an email. But if there are no other thoughts...
How does the Bible feel about all this stuff?
How does the Bible feel? Well, how does the Bible feel about vampirism? We could talk about, say, Roman Catholic traditions, Roman Catholic liturgy, and the extent to which it involved the symbolic drinking of blood. So I'm not certain that the Bible comments explicitly on it, apart from that. Okay? In that case, thank you very much, everybody, again.